Hello everyone. So this is a simulated trainee task assessing communication with colleagues, patient safety, applied clinical knowledge. You are the on-call registrar today. A junior colleague is requesting to know more about the forest plot. You are required to teach her and support her in the ongoing training. And they give you an example of a forest plot there. So it is a teaching station. So we'll go for the frame of teaching as any teaching station. So you introduce yourself by name and role without putting like a step between you and your colleague. So say your name straight away, and then welcome him to the or her to the department. I understand you are the one who recently has joined our department. How's everything going so far? And you offer your help and support. If you feel any difficulty at any point, please don't hesitate to contact any of us. We are just here for helping and supporting you. And then you tell that I believe that you are the one who wants to learn more about forest plot. Is that right? Yes. So can you tell me why do you want to learn about it? So that's how you introduce yourself or make the introduction for the session. So he will give you the reason why he wants to learn about the forest plot, and then you appreciate his concern, and then you put a plan for the session. So we are going today to speak about forest plot. What is the meaning of forest plot? How to interpret that? And I will show you the graph and how to read it. And then after that, if you have any question, you can stop me at any time. Okay, and then you go ahead. Okay, so I know the first plot is something which may be a bit complicated if you see it for the first look, but if you understand it well, it will be very easy. So what is forest plot? So forest plot is a graphic representation. Like we have something, we need to present it on a graph. What is this thing? The thing is the result of multiple studies. Okay, like sometimes these studies are done in the same place or different places, different countries, you know. So like for example, if they study the effect of progesterone pessaries on the incidence or happening of preterm delivery, and they make a randomized controlled study, for example in Egypt, one study in Egypt, one study in Kuwait, one study in UK, and so on. And then they will get the result from each of these studies, and then these results to be interpreted into a graph, which is the forest plot, so that we can take the like overall estimation of the result and to gain information about whether it is statistically significant or no, or what is the intervention result, like, you know, have we all resulted in favoring the intervention, like we advised to give this progesterone or we don't advise to give it. Okay, so this overall assessment called systematic review. Okay, and what is the meaning of randomized controlled studies? Randomized means it is randomly distributed. What is the meaning of that? Like if I'm doing a study, I need two groups and I need to compare, like, you know, we have the intervention group and the control group, so that I can compare the result in both groups and like get information if this intervention is really beneficial or no. But if it is randomized, the person who's doing the study may not be able to know which group is the control and which group is the intervention. He will be given two kinds of medication. This is medicine 1, this is medicine 2. One of them will be placebo and the other one will be the effective medicine, and this is group 1 and this is group 2, and they will be distributed randomly, and he will start to intervene with drug 1 with group 1, drug 2 with group 2, and then the end result, after he gains the result, then they will explore to him what was drug 1 and what was drug 2, so that he can realize what are the results of his study. So this is how the randomized controlled, this is called the double-blind controlled randomized study. So if we have many or multiple studies of randomized controlled studies, we get the result of each one and put it in a graph. We call it a forest plot. Okay? So that's roughly what the forest plot represents. So how to interpret? If you see on the screen, we have a graph with one horizontal line, which is divided in the middle by one vertical line. Okay, so the horizontal line is having two sides. The right side is favors intervention, and the left side is favors control. And you can see all the plotting of the results of the study came to the side which is favoring intervention. Okay, some forest plots will have some studies on this side, some studies on this side. It's not necessarily that all the study results should favor the intervention. No, we do the forest plot to see what are the results is favoring. Okay, so this is favors controls and this is favors intervention. And the line, which is the vertical line dividing this, is called the line of no effect, the zero line or line of no effect. Okay, what is the significance of line of no effect? This line of no effect, if any study crosses this line, it is statistically insignificant study, so we can cancel it from the whole results because it is not statistically significant. If you can see here, study 1 and study 3, they are crossing the line of no effect, so they are statistically insignificant. Okay, so we shouldn't cross this line. We have to be on either side of this line, but if we crossed this line, that means the study is not significant, not statistically significant. Okay, so what is the meaning of these black squares and these horizontal lines passing through them, and what is the meaning of this diamond down? Okay, so each square represent the sample size. Okay, and the bigger the square, the bigger the sample size, and then the bigger the way of the study. The study will be more important, and it will weigh more in the result. Okay, so the study which have a bigger squares will have more weight. The study will be more important, and the studies will have which have a smaller squares will be less important and weigh less in the result. Okay, and these lines crossing through the squares is called the 95% confidence interval. What is the meaning of confidence interval? Like, you know, it's something in the statistics which give us a range where all the results of this study come within this range. So if the result of the study came within a wide range, that is insignificant, because we should have a smaller range to keep it more confident result. So if you see these lines are long, so that's less significant or statistically insignificant. If it is shorter, it will be more reliable and more significant. So if you can see here, so it is the opposite to the size of the square. So we need the square to be bigger and the 95% confidence interval line to be shorter and not crossing the line of no effect. Okay, so which one is the most important and the most really significant and reliable study here is study 2. And which one is the least significant study here will be study 3, because study 3 has the least square size, the longest 95% confidence interval line, and it is crossing the line of no effect. Okay, if you see different forest plots, you will not find this much of studies only. Like we have here 4 studies just for explanation, but many of the forest plots can have like around 10 studies or more, so we can really have an idea and compare different studies, and some of them can be also favors control. It's not necessarily that all the studies come on one side. Okay, what about the diamond in the bottom? This is the overall estimate of the whole studies. We calculated all the studies and we take the overall estimate in the shape of diamond. So this diamond, we will see like overall, this study favors intervention or this study favors control, or if this diamond crossing the line of no effect. So we will get to the result that this study is statistically insignificant. We didn't get any significance from the study. Okay. So overall in this study, it favors intervention because the diamond came on the right side and it is not crossing the line of no effect. And the distance between the two angles of this diamond is the 95 confidence interval. It is not a too long thing and not crossing the line of no effect. So it is statistically significant and favors intervention. This is the overall estimate. Okay. There is one remaining thing we need to know about, which is heterogeneity. What is the meaning of heterogeneity? I told you that we are like representing on the first plot the results of the studies that are like same or like similar studies. Okay, but I can't compare different studies in one first plot. Like I can't put one study which is like comparing progesterone effect in preterm labor and the second study to compare clomiphene citrate with another letrozole or something else in ovulation induction. They are two different studies and will give us much more bias, and we will not gain any relevant information. So we need to be sure that all the studies are like, you know, not really identical, but, you know, study the same issue or the same thing, so we will avoid heterogeneity. Most of the forest plots, you will find a square on one of the sides of this forest plot will tell you how much the heterogeneity in the studies included. So if it is less than 50, that is normal. So if it is 50, so it is low heterogeneity. No, if it is 25, it is low. If it is 50, that will be moderate, and if it is 75%, that's high heterogeneity. So if there is too much heterogeneity, that will make the result invalid, and because we are just comparing nonsense, different kind of studies, and we will not gain a reliable information. Okay. So after explanation of all of these, you can ask your colleague to repeat for you, like, what does this square represent? What does this line represent? What does this line represent? And what does this diamond represent? And then appreciate his effort and like, you know, that's great, you are a fast learner, and then you offer him like to see some videos on the YouTube or to read about forest plot and strategy and see different charts of the forest plot and try to read them. and if he found any difficulty, he can refer back to you. You give him your contact details and ask him at any time. He can come and ask for any other thing if he want, and also don't forget to ask about his feedback about the teaching session. Okay, thank you.